Ministry of Health of Ukraine. Krok 2. Medicine. Year 2019, number 195. A 3-year-old child has been brought to a hospital with complaints of pain in the legs, fever, and loss of appetite. Objectively, pale skin and mucosa, hemorrhagic rash. Lymph nodes are enlarged. Painless, dense and elastic, not matted together. Bones, joints, and abdomen are painful. The liver and spleen are enlarged. Hemogram. Hb 88 grams L. Color index 1.3. Platelets 80 to the power of 9 L. Leukocytes 25.8 times 10 to the 9 L. Lymphoblasts 70%. ESR 52 mm per hour. Make the provisional diagnosis. A. Hemorrhagic vasculitis, Henoch-Schonlein purpura. B. Acute leukemia. C. Thrombocytopenic purpura. D. Acute rheumatic fever. E. Infectious mononucleosis. Leukemia begins in the bone marrow, where new blood cells are made. As a result, a child may not have enough normal red blood cells, white blood cells, and blood platelets. It can be shown up on blood tests as well as symptoms. Symptoms: anemia, fatigue, weakness, feeling cold, dizziness, lightheaded, shortness of breath. Paler skin. Lack of normal leukocytes, likely to lead to infections, fever. Often leukocytosis, but most of them are not protective. Thrombocytopenia, easy bruising and bleeding, especially nose. Gums. The normal number of platelets in the blood is 150 to 400 times 10 to the power of 9 L. Bone or joint pain. Caused by the buildup of leukemia cells, immature still developing white blood cells, near the surface of the bone or inside the joint. Hepatosplenomegaly, swelling of the abdomen. Leukemia. Cells can accumulate in the liver and spleen, making these organs bigger. This can lead to loss of appetite and weight loss. Swollen lymph nodes. As leukemia cells multiply, they may collect in the lymph nodes. Coughing or trouble breathing. An enlarged thymus or lymph nodes in the middle of the chest can press on the trachea. In leukocytosis, leukemia cells can build up in the small blood vessels of the lungs. Superior vena cava syndrome. Swelling in the face, neck, arms, and upper chest, sometimes with a bluish-red skin color. It can be accompanied by headaches, dizziness, and a change in consciousness if it affects the brain. It can be life-threatening. Headaches, trouble concentrating, weakness, seizures, vomiting, problems with balance, and blurred vision, in case it spreads to the brain and spinal cord. Chloroma, granulocytic sarcoma, or rashes. If acute myeloid leukemia spreads to the skin, it can cause small, dark spots, swelling, pain, and bleeding in the gums. In acute myeloid leukemia, leukemia cells may spread to the gums to cause it. Extreme fatigue, weakness, and slurring of speech. In acute myeloid leukemia, very high numbers of leukemia cells thicken the blood and slow the circulation through small blood vessels of the brain. The answer is B. Acute leukemia.